is correct. Sperm blockage affects the male reproductive system. It occurs when there's an obstruction in the sperm transport pathways. This prevents sperm from being released during ejaculation. As a result, it can lead to male infertility. A blockage can occur at any point along this pathway. Understanding sperm blockage is crucial for addressing infertility issues. The good news is that sperm blockage is often treatable. Advances in medical technology offer hope for successful conception. Several factors can lead to sperm blockage. Infections are a common cause. These can be bacterial or viral, and often result in inflammation or scarring of the tubes through which sperm must travel. Conditions such as epididymitis or prostatitis are examples of infections that can lead to blockages. Injuries to the groin area can also cause blockages. Physical trauma may damage the reproductive organs or the tubes, leading to scar tissue formation that obstructs sperm flow. Similarly, surgeries in the pelvic area, such as hernia repairs, can inadvertently result in blockages due to scar tissue development. Congenital conditions are also a significant cause. Some men are born with abnormalities in their reproductive tract that include missing sections of the vas deferens or blockages that have been present since birth. This is often a genetic issue that may go unnoticed until fertility problems arise. Lastly, cysts or tumors can physically block the sperm pathways. These growths may develop within the reproductive tract and obstruct the normal flow of sperm. While less common, these causes require immediate medical attention to remove the blockage and restore fertility. Symptoms of sperm blockage can vary, but some are more common than others. One of the primary signs is a low sperm count. Men with this condition may produce semen that contains little to no sperm, which is detected during fertility evaluations. Pain or discomfort in the testicular region is another symptom. This pain can be due to inflammation or the pressure that builds up behind the blockage. It is often accompanied by swelling or tenderness in the affected area, which can be distressing for the individual. Testicular swelling might be noticeable, particularly if the blockage causes a buildup of fluid or pressure. This can lead to visible enlargement of the testicles or epididymis, and might be accompanied by sensitivity to touch. Lastly, general signs, such as difficulties with ejaculation, or a noticeable decrease in semen volume during ejaculation, can indicate a blockage. These symptoms suggest an interruption in the normal functioning of the reproductive system and should be evaluated by a healthcare professional for a clear diagnosis. Section 4. The Diagnostic Journey. Diagnosing sperm blockage involves several steps. A semen analysis is often the first test conducted. This analysis evaluates the quantity and quality of sperm in a semen sample. Low or absent sperm counts can suggest a blockage or other issues with sperm production. Imaging tests such as ultrasound or MRI are frequently used. These tests provide a visual representation of the reproductive organs, helping to identify any physical obstructions or abnormalities. They can reveal cysts, tumors, or scar tissue that may be causing the blockage. Another diagnostic tool is a testicular biopsy. This involves taking a small sample of tissue from the testicles to examine sperm production. If sperm are being produced but not present in the semen, this indicates a blockage in the tract. In some cases, specialized procedures such as vasography may be performed. This involves injecting a contrast dye into the vas deferens to identify blockages. The combination of these diagnostic methods helps provide a comprehensive understanding of the issue, allowing doctors to tailor treatment plans effectively. Section 5. Options for treatment. Treatment options for sperm blockage are varied and depend on the specific cause and location of the blockage. Surgical intervention is often the most direct approach. Procedures such as vasovasostomy or vasoepididymostomy can reconnect the severed or obstructed parts of the reproductive tract, allowing sperm to flow freely again. Aspiration techniques are also used, especially when surgery is not viable. These procedures involve extracting sperm directly from the testicles or epididymis using a needle. This sperm can then be used for assisted reproductive techniques like in vitro fertilization or IVF. Medication may be prescribed, particularly if the blockage is caused by an infection. Antibiotics can reduce inflammation and clear up infections, potentially resolving the blockage and restoring fertility. The success rates for these treatments are high. Advances in surgical techniques and reproductive technology have greatly improved outcomes for those with sperm blockage. Many men have successfully achieved pregnancy through these interventions, providing hope for those facing infertility due to blockages.